Hi, I'm Dr. David Hill, and today we're going to talk about how to calculate when a baby is due. Now, that calculation seems relatively straightforward, and much of the time it is. The last menstrual period that mom had prior to finding out she was pregnant, or prior to not having any more of them, is considered day one. You count forward 40 weeks from the day of the last menstrual period. That's what we in medicine call the child's gestational age. Now, why don't we use the day of conception? Well, most of the time the day of conception is not all that clear. It's usually sometime between 11 and 21 days after the start of the last menstrual period, but which day? Hard to know. Whereas in many cases, the start of the last menstrual period is an easier date to identify. That said, it's not always an easy date to identify. Some women have irregular or spotty menstrual bleeding, and they may not really be able to say when that last period started. In that case, our next best guess is made by ultrasound. Now, if you're being followed by an obstetrician through your pregnancy, he or she is probably doing regular ultrasound. And the ultrasounds do a pretty good job of predicting how far along that baby is. In fact, the ultrasound computer will create a predicted due date, and those are often quite accurate. The fact is, very few babies are actually born on their due date anyway. So as long as you've got it within a week or two, you've got a pretty good sense of whether a child is preterm or post dates. That is really the goal, knowing that the child is going to be born safe and healthy. Talking about how to calculate when a baby is going to be due, I'm Dr. David Hill.